Welcome back to Vaccine Choice Canada.
This is the most important and probably the most difficult decision that they'll be asked to make.
It's a 200-year, multi-generational myth.
When I was in medical school, I learned nothing about what was in vaccines.
We want responsiveness from the medical establishment and from the government.
This is something that permanently alters your child's immune response.
We advocate for informed consent and voluntary vaccination decisions.
What are we afraid of?
This information is not intended as legal, health, or nutritional advice. It is provided for informational purposes only. Vaccine Choice Canada does not endorse or accept responsibility for statements, views, and opinions presented by its guests.
First of all, welcome to everybody. Thanks for joining us. It's always a delight to have you. We've got our friends from Vaccine Choice Canada and the members of Canada Health Alliance with whom we invite into these conversations. So, and those joining us for the first time, a special welcome. My name is Ted Kuntz, and I'm the president of Vaccine Choice Canada, and my co-host again this evening is Dr. Stephen Malthouse. Dr. Malthouse practiced family medicine in Canada for 45 years, integrating the best of conventional and complementary therapies with a special interest in homeopathic medicine. Dr. Malthouse is the founding president of Canada Integrative Medicine Association, past president of the Canadian or Canada Health Alliance, and a longtime supporter of Vaccine Choice Canada. His wisdom and experience as a frontline physician are valued in these conversations. This evening's conversation is another episode in our Raising Healthy Children series. This evening is the 10th in a series of conversations Dr. Malthouse and I have hosted, where we examine the claims of the medical industry, most especially the safety and efficacy of vaccines. Our guest this evening is Dr. Larry Palevsky. It's been more than 2 years since we had Dr. Larry as a guest, and we've had many requests to have him back. Dr. Larry is passionate about supporting children's immune systems naturally. This makes him a perfect guest for our Raising Healthy Children series. Our goal with these conversations is to assist parents and adults to make informed decisions based upon quality scientific evidence. Stephen, would you introduce Dr. Larry for us?
Yeah, it would be my pleasure. Dr. Palevsky is a New York State licensed pediatrician who utilizes a holistic approach to children's wellness and illness. Dr. Palevsky received his medical degree from New York University School of Medicine in 1987, completed a 3-year pediatric residency at the Mount Sinai Hospital in New York City in 1990, and he served as a pediatric fellow in the ambulatory care outpatient department at Bellevue Hospital, New York City, from 1990 to 1991. Since 1991, his clinical experience includes working in pediatric emergency and intensive care medicine, inpatient, outpatient pediatric medicine, neonatal intensive care medicine, newborn and delivery room medicine, and conventional, holistic, and integrated pediatric privacy practice. I think I got them all there. In his current pediatric practice, Dr. Palevsky offers well child examinations, consultations, and educational programs to families and practitioners in the area of preventive and holistic health, childhood development, lifestyle changes, nutrition for adults, infants, and children, safe alternative treatments for common and difficult to treat acute and chronic pediatric and adult conditions, vaccination controversies, mindful parenting, and rethinking the medical paradigm, which we very much need. Welcome, Dr. Larry, and thank you very much for joining us.
Thank you, Dr. Malthouse. Thank you, Ted. It's a pleasure to be here again.
Yeah, nice to have you. I've got such fond memories of our conversations with you, and you were just mentioning that we had you in, what was it, October of 2020, so right at the beginning of all of that insanity. And you reminded us, I asked you what you thought about the COVID vaccine, and what did you say?
I said, do you want my short answer or my long answer?
And the short answer was?
That it's a murder weapon.
Boy, you had a pretty clear idea back then what we were up against.
Yeah.
I'm just curious, what had you so clear back then, even in October 2020, about what we were up against?
Well, first of all, I never believed that the COVID illness was due to an infection.
Oh.
And so how could you be offering a vaccine for something that, in my view, was not an infection? And so that cued me in. The other thing was that they were utilizing chemicals in the shot, those that we knew about at the time, that had never been studied for safety and that had never been used before in vaccinations. And so it was clear to me that they were hiding information. And let's say that the COVID illness was an infection. Let's be hypothetical for a second. Never in the history of vaccination had we ever used mRNA technology to decipher whether or not an infectious illness could be prevented by its use. And so the fact that we were just throwing it in there without any scientific precedence or any clinical precedence made me extremely suspect. Mm-hmm. Plus, the whole COVID shutdown to me was an attempt that I saw from March, April of 2020 till then, as an attempt to create one world government and global government. So it would already been clear to me that there were very dark forces at work, especially when I saw, Canadian physicians, United States physicians, European physicians who were successfully preventing the COVID illness and successfully treating the COVID illness. And they were ostracized, they were eliminated, they were lost their licenses, and they lost their hospital privileges. They were bankrupted for all the lawsuits that they had to go through. So nothing added up, Ted. And it just seemed like they were ignoring the things that clinicians were doing to help patients, because if they publicized what clinicians were doing to help patients, they couldn't use the emergency use authorization to allow for the COVID injection to be put forth. And so it was a real psyop. I mean, it was really a psychological operation to convince people that we had something that was going to save them. And then I think the last thing was the real kicker. They were telling us that spike protein was what was making people sick from COVID. But then they were injecting us with a technology that was supposed to make the body produce spike protein endlessly. So with no real understanding if there was any moment in time where that production would stop. And so it seemed to me very clearly that you were taking something that you assumed people were not exposed to, because that's the purpose of vaccination, is to give you an injection of something that you're believed to not have been exposed to. So in the event you are exposed to it, you will have protection from the injection. And yet they were giving you the very thing that they said you weren't exposed to, and with no information as to whether or not your body would ever turn it off. And so they were giving you COVID.
Yeah. Boy, it was so inverted and so perverted. That must have been painful for you to have such clarity back in October of 2020, and then witness the tyranny and the harm that's happened over the last 5 years.
Well, I think I could scan the 64 years of my life to say it must have been very difficult for me to see the tyranny and the lies.
Yeah.
When I started seeing things as a very young child, where things weren't making sense even then. So yes, the answer to you is yes.
Yeah.
You sound like you're very perceptive, even back when you were beginning as a doctor.
Well, I didn't notice it until after later when I really knew what it was. But, when I worked in the ICU, I worked in the neonatal ICU, and I went to, high-risk deliveries. And there was just something that was very immediate for me in being able to scan a situation and know what was needed right then and there. And then, I have a great BS meter. And it was from a very early age. So as I got on in my years and on in practice, I started seeing more that just didn't make sense. I mean, let's take, for instance, 1990. I was a fellow in pediatrics from 90 to 91, and we get this hepatitis B mandate for all infants. And I remember Steve saying, wait a second, every vaccine we've had up until now has always been for a disease that was known to affect that population. Why are we giving a vaccine against a disease that isn't prominent, prevalent, or even once in a while seen in that population? And at the time, I had no understanding that there may have been a problem with vaccines. I was just looking at it as, wait a second, this doesn't make any sense. Why are we doing this? And my colleagues just looked at me and went, like that. I said, no, guys, this doesn't make sense. And then 5 years later, in 1995, I ran into a pediatrician who trained me 10 years earlier in med school. And I said, Mike, are you giving because he was in private practice. I said, are you giving the hepatitis B vaccine to the newborns in your office? And he said, yeah. And I said, why? And he said, because we have to. Ooh. And I looked at him and I said, Mike, that makes no sense medically. And so I just always had that smell, so to speak, as a physician and as an individual that said, oh, wait a second, this is BS, or, I think you're lying. And it's done me well, because in the office, when I'm working with patients with complex issues, I can hone in on, what do I think is the underlying root cause that's going on that would really address how to help this child in this situation. So yeah, I do my best.
You are a gift. I mean, as I listen to you, Dr. Larry, your way of practicing your craft isn't very common anymore, isn't it? And if anything, they want to replace it with AI technology, don't they?
Well, I'll tell you, Ted, November 12th, 2025, there was a MAHA summit in Washington, D.C. at the Waldorf Astoria, and they were talking about the great biotechnology and AI that we can invest in and look towards to create greater health. And I knew right then and there that we cannot, should not, and probably better not look to our authorities to help us to create health, because that's really just what venture capitalists do when they see an opening to make a lot of money. And I'm sorry, but as long as I'm alive, children are not there to be, feasted upon to make a lot of money. They're there to be honored and respected to their highest good. And I'm sorry, but AI is an evil, to me, is an evil force that I really don't even know who's behind it all or what the agenda is. So if I'm gonna make children well again, it's not gonna happen with technology. It's gonna happen with other things, and I'll leave it at that, because I have a feeling that's where you're gonna go now, Ted.
Well, again, you're using your intuitive skills and the skills that you honed over your career to understand or assess a medical condition of an individual and then provide help. And what's happening now is that doctors are forced to simply follow protocols. And I was reading an article today from a nurse who was saying that they do the online, when people call in to ask, they've got a problem and trying to assess the situation about whether to go to emergency or what. And he said, we're now being monitored by AI, and it makes recommendations to us while we're on the call with people.
Sure.
And he said it'll be weeks or months before I'm no longer there, and it'll just be the AI.
Right. And Ted, unfortunately, that started with insurance companies taking over medical practice, with insurance companies deciding what doctors could and couldn't do. And now you have an evil, lurking, protocol-driven technology that's telling doctors what to do. And then once that becomes perfected, then they won't need doctors. And, that's where people really lose touch with their own ability to heal themselves, their own ability to take care of themselves. And, that's one direction that many people might go. But as long as we're alive, I think that we're going to do what we can to resurrect good medicine.
That's a good question, though, about how we do that. There's some elements that we need to bring back into the way doctors practice. The reason I say that is because I think a lot of people will themselves choose AI over the unavailable doctor. And because it's smarter, that's, their approach. And also they've done some studies showing that people actually professionals as in other doctors evaluate AI responses to be more compassionate, actually empathetic is the term they use, than the regular doctors. And they ask the doctors, why not? They say, well, we don't have time to be empathetic. So how are we going to change doctors to make them competitive, or to make the people want to go see a doctor when they're hard to find nowadays instead of an AI machine?
I think that's a really good question, because that question says, how do we change the system from the top down? And I've always been someone who looks to change any system from the bottom up. And if you really educate people, I mean, there are going to be plenty of people who want AI, and I would never be someone to say to them, don't do it. I might educate them as to what the pros and cons are, but I wouldn't say, don't do that. It's not good for your health. But what I would say is that those people who reject AI, those people who want the personal interaction, if there are any left in the younger generations, then we can work from the bottom up, and they'll make the demands for that kind of, and believe it or not, I mean, I can envision good medicine becoming a specialty, right? Because, AI will be the way, and critical thinking and personal medicine and individualized medicine will be a specialty. And that's okay, because, there's always pendulums. Mm-hmm. And I think we're on one of those pendulums where, the kind of medicine that I was taught and that I've been practicing since the 1980s, which is medicine that I was taught from the 1940s up to medical school and residency, is valuable. And, to take a history and a physical, and to know that in taking a history, I can probably know right away what's going on. And unfortunately, right now, if you go into the emergency room with a belly pain, you're not going to get seen by the surgeon until after the CAT scan is done, or after multiple tests have been done. And, that's not medicine to me. And I remember the days when, if we had a child with anemia or a child with blood in the urine, we could not call the hematologist or the nephrologist until we had done as much of the workup as possible. And then when we got to where we could do what we could do as residents, then we were allowed to call the hematologist and the nephrologist. So that's how we learned to really practice medicine. Nowadays, I mean, I don't think a resident would know what to do if a person had blood in the urine, let alone, other than call the specialist, or just look it up on AI and let AI tell them what to do. And, I think the beautiful study out of MIT showed that when students use AI for college and for papers, they have maybe 46% retention of what they learned, and really couldn't regurgitate the concepts because it wasn't theirs. And that's the dangers of AI, is that is that it takes people away from ownership of what they know. And that's what becoming unburdened by what might have been has been.
Who said that? Who said that? Was that your
I don't know. I think
most
she's
recent
somewhere.
president try for president there?
I think she's somewhere on a floor somewhere with a bottle in her hand, just getting over.
Probably to be unburdened. Yes.
Yeah. No, but that's been purposeful. If you make people forget,
Right.
they'll never know that they needed to know. And that's what AI does. That's what all the technology does. It strips people of the ability to have ownership of what they know. And what better way to have obedient, subservient, and weak members of society than to not let them know anything unless it was handed to them.
I think I would add isolation as well with that. They don't have to go into a family's doctor and actually meet another human being. They're doing it over the telephone or screen. And the other one was creativity, particularly from a doctor's perspective. We don't have to use our thinking apparatus to work our way through and find solutions which aren't in the algorithm, which are going to be pretty common. The other one is that when you get into AI, of course, it depends on who programs the AI. And so far, we've seen a lot of deceitful AI and hallucinating AI, and who's holding the control of it. So there are so many issues in that.
Well, I think we know who's holding the control of it.
Yeah, I think we do.
We don't know the individuals, but we know the systems that are involved. And they are directly related to the attempts to make a one world order, a global government.
We know their intention. Yes.
Sure.
Yeah.
And the fact is that they don't hide it. They don't hide their intention. They don't want to hide their intention. And so, okay, well, if you are kissing the papal ring and not, I'm using that as a metaphor, not as a literal thing, but if you're kissing the papal ring and you're not curious and you're not questioning, and, I often say that the dumbest question is the one not asked. And so ask the question. If you're not asking questions, then you're losing what distinguishes us as one of the most special mammals in the animal kingdom, which is, the frontal cortex.
So your messaging talks about rethinking the medical paradigm. What does that look like? Or what do you mean by that?
So on November 8th, 2025, I gave a talk at the Children's Health Defense Conference in Austin, Texas. And the title of my talk was Make Children Well Again. And one of my slides was a slide of a basement with a flood in it. And I said that if we were to use that flood in the basement as a model for how we practice medicine, we would get very proficient at getting the water out of the basement. And that would be all. Because that's how Western medicine is practiced. It just takes care of the problem, but it never addresses the cause or the root contributing factors. And so no one would ever just get the water out of the basement without trying to understand what created the water in the first place. And so rethinking the medical paradigm is, instead of just taking care of symptoms, instead of just taking care of complaints, we actually do the best that we can to look at the root causes and the contributing causes to what brings the symptoms on. Because in my view, symptoms are often the body's attempt to create a solution to the problem. They are often not the problem. And so that means that if a kid has increased mucus coming down the nose and a cough, that's actually a very successful attempt by the body to clean out a mess of increased inflammation, increased wastes, increased impurities. But in Western medicine, we say, no, mucus no good, cough no good, must be an infection, and we just suppress it. And by suppressing it over and over and over again, what we end up having is a kid who's now chronically ill with either tonsils that are really big, or the kid is diagnosed with ADHD, because the wastes went further in the body when the body's natural healing mechanisms are meant to bring the wastes out to the surface. And mucus is one of the body's most gifted ways of eliminating wastes. And so we would never just look for ways to get rid of the water in the basement. We would try to understand the cause of what's producing the water. We would also not just thin the mucus so that the body can remove the rest of the waste. We would actually start to identify what foods, what air, what stressors, what is going on in the environment of the child that's creating the body's need to make so much mucus and to get a cough, such that the body had to work overtime to clean itself out. That's a different paradigm. And at the end of my talk, when I said, how do we make children well again? My statement was, it ain't enough to not vaccinate. Meaning, there are a lot of people who are learning that vaccines are not safe. A lot of people learning that vaccines don't work. A lot of people learning that they may not even protect you against disease. But then they walk away and say, well, good, I can do anything I want and my kid will be fine. And we know that if we're going to raise healthy children in a more toxic world than it was when we grew up, we're going to have to do more than not vaccinating. So it ain't enough to not vaccinate.
It's quite a bit, though, you got to say. I mean, in Canada, we have 6 vaccines that are recommended during pregnancy, which is a shocker. And none of them have safety testing. The manufacturers don't recommend them on their inserts. And the women seem to have forgotten the idea that their baby, what they take is going to affect their baby, and they should be extremely cautious. It seems as though there's a hypnotic spell that's been put on women, and it's encouraged. Probably also a part of under the spell are the physicians or even the midwives who are giving those vaccines. It's really atrocious.
Right.
Yeah.
So I'm a little bit disturbed that the only conversation we're having around vaccines are safety and effective. And I think it's important to start changing the narrative. And how I would suggest changing the narrative is to start addressing all of the concepts that we're taught that form the basis of why we vaccinate. And so one of those concepts is vaccines teach the immune system to recognize microorganisms before a person encounters them. Because it is believed, and I'll say that again, because it's not something we often talk about, so it's not on the tips of our minds or our tongues to really explain. Vaccines teach the immune system to recognize organisms before a person recognizes them. The assumption of vaccination is that diphtheria, pertussis, and tetanus, Haemophilus influenza B, the 15 or 20 Streptococcus pneumonia in the Prevnar, and the 4 bacteria in the Neisseria meningitis shot do not enter children's bodies. And by the time we vaccinate them, these organisms will be introduced to children in the event at some point they will be introduced to these 20 or so bacteria. Yet, children live with over 100 trillion bacteria in their nose to lungs, mouth to anus, and all over their skin. And so what they're telling you is that by the time we vaccinate children with 20 some odd bacteria, they haven't been exposed to those. But the 100 trillion minus 20 something, sure, we have been exposed to them. And so we have to show the lie that you can be exposed to hundreds of trillions of bacteria, breathe them in, eat them, put them on your skin, and not get sick. And to think that the human body, even a 2-month-old who doesn't breathe in trillions of bacteria is preposterous. And so we teach false concepts. That vaccines teach the immune system to recognize organisms before the body encounters them, because it is only believed, which is another lie. So this one is a lie. It's only believed that you get an infectious disease only when someone is sick and gives them to you. And so if there's no one sick with pertussis in the environment, there can be no pertussis bacteria in the environment. As if to say, exposure to a germ can't happen unless you're exposed to someone who's sick, who gives it to you. And that is a blatant lie. Because you can not only be exposed to pertussis and not get sick, but even if you just have a common cold, you can have pertussis and not even know it. And so we are teaching wrong concepts because the whole vaccine program is based on a house of cards. Mm-hmm. And so if we start talking about the idea that there is never a moment in our lives where bacterial exposure doesn't happen. Every millisecond of our lives, as long as we are alive, as long as we're breathing, and as long as we're eating, and as long as we're touching, and as long as we're here, there is constant bacterial exposure. And what they're saying is, oh, no. Only the bacteria that we don't vaccinate against, we're exposed to. But the ones that we do vaccinate against, nope. You couldn't possibly be exposed to them, because the only way to be exposed to them is if someone is sick and gives it to you. Two big lies. And I really feel it's so important that we start talking about this. And I have a plan to continue this dialogue ad nauseum, because it has to be repeated over and over and over again, because people think, well, I'm not sick, so there are no bugs going around.
Right.
Well, that's preposterous, because my English teacher would not like me. There's never not bugs going around. Never not. And so there are always bugs going around. So to think that the only time there's a bug going around is when kids are sick or when adults are sick is a lie. And once you start exposing the many lies upon which we base vaccination, we'll stop talking about safety and efficacy, and we'll start talking about, wow, this is all bull. Especially if you wanted to talk about herd immunity, because herd immunity is another big fat lie.
But if you vaccinate enough people, you get herd immunity, and then everybody's protected.
Big fat lie, Ted.
Yeah, it's a contagion myth I think we're looking at here. At least partly. I think there's more to it, but part of it is that all those diseases are caused by contagion from a sick person, whereas in fact, you've probably been exposed. There are other elements that cause maybe contagion. We did have Daniel Reuters on, speaking to him, and Can You Catch a Cold? And this idea of contagion has been pretty much undermined by a lot of the research. So then what's left? What's the paradigm we have to? Where does illness come from?
So I'm gonna comment about something you said, because I love what you said. I did a podcast with Alex Zeck that's going to air sometime in the next month or so, And I surprised him. And I said, we have contagiousness all wrong. I said, contagiousness is a constant.
Mhm.
There is never not contagiousness. Contagiousness occurs every second of every day of your life because you inhale organisms, you exhale organisms, you ingest organisms, you breathe out through your mouth organisms, you touch organisms, you shake people's hands, they shake your hand. Contagiousness is always happening. And we don't get sick. And so we only think that germs are exchanged during an illness. And what we must start to, I mean, it's right in front of us. This is not rocket science. We must teach that contagiousness is a constant, that we are always catching germs, we are always releasing germs, and we are always exchanging germs. And not only that, we are always getting germs in our bloodstream. And we are always manufacturing germs inside the cells of our body. And
That's another parasite. That's a different way of looking at things, Larry. I mean, we're actually manufacturing germs?
Yes. You see, people really believe that I'm going to use my New York slang, that there ain't no virus around until someone is sick and gives it to you.
Right.
But if we actually go into the medical textbooks, it'll tell us that almost half of our chromosomes contain the DNA that make viruses and viral particles. So we are always manufacturing viruses and viral particles.
And we're always swimming in a sea of it.
Correct. So that doesn't mean we're infected a lot. That means we're constantly replicating viral material. But that's not equivalent to infection.
Right.
And the mitochondria in our cells, right? Every cell of the body except red blood cells contains mitochondria. Thousands of them. And what were mitochondria before they became parts of the human body? Bacteria. And what numbers of bacteria do we have lining our body? 100 trillion or more. And what do bacteria contain? Viral genetic material. So there's no way that the human body can avoid contagiousness on a millisecond to millisecond basis. And so we must start teaching the truth about what germs are, where they are, what they're doing here. And the hardest part is to recognize that they are symbiotically there to help us stay well and get sick to stay well.
Oh, can talk about that, please.
Yeah, I mean, if you look at why we have microorganisms on the body, I mean, we're infested. We have as many microorganisms, if not more, than we have numbers of cells in our body. And so you brush your teeth, you get microorganisms in your bloodstream. You wipe your behind, you get microorganisms in your bloodstream. You pick your nose, you suck on your fingers, you bite your nails, you eat food, you have sexual intercourse. Those microorganisms are going into the bloodstream. Nothing happens. And so not only is exposure to germs not an infectious cause, but germs going into your bloodstream is not sufficient to cause an infection. So the question is, well, why are all these germs there? Why do they line the nose to the lungs, the mouth to the anus, all over the skin and in the women's reproductive tract? Why are there viral materials inside the cells? Well, I remember about 30 years ago, after being out of fellowship for about 3 years, I remember a chiropractor saying to me, you know, the body has the innate capacity to heal. And I was like, what? Medical school? That's a foreign concept. And so as I got to learn what that meant in the Western medical perspective, I realized that the microorganisms that are lining our body, ears, nose, mouth, tonsils, sinuses, adenoids, nasal pharynx, throat, airway, bronchus, main bronchus, bronchioles, all the way down through to the anus. Well, they serve a purpose. And they serve a purpose to, one, protect us, two, help us digest, three, manufacture vitamins, four, interact with the immune system as antenna to make sure that all is well, five, interact with the brain to signal the brain as to the environment, six, help us get rid of wastes. So on an ongoing basis, the microorganisms, both viruses and bacteria, are working inside the cells and outside the cells to clean us out. Our bowel movements are in part triggered by the microorganisms in the rectum and the colon. The tonsils have bacteria lining them all the time. So do the lymph nodes in the digestive tract. What are they doing there? They're helping to protect, and they're helping to wipe out the wastes that come out to the tonsils and out to the lymph nodes. So we're relying on the microorganisms to help clean us out. And so we only think that if you get sick, oh, there must be a new bug that arrived. Well, no, those bugs are always there. Except that now, instead of you just simply exhaling your wastes out, or urinating your wastes out, or pooping your wastes out, or smelling them out, or rashing them out,
Yeah.
or sleeping them off. Now your body says, okay, too many wastes. Too many wastes. I can't keep up. And so the cells will trigger the production of viral materials to push the wastes out of the cells. And what do? They bring them out to the surface. And what do inflammatory materials on the surface do? They cause inflammation. And what does inflammation cause? Mucus. And what does mucus do? Drag the wastes out. And so we're looking at why the organisms are in our body all wrong. Because we're never not germed, if that's a word.
So I've got more questions, but I see Dora Lee's got her hand up. Dora Lee, you want to wade into this?
I don't think she can unmute herself. Oh, there you go. So I should just introduce, if Dorley, just give me a chance to just introduce you. Dorley Neifel, she's the president of the Canada Health Alliance. She's a medical doctor, practiced in the Vancouver region. And hi, Dorley, you've got a question for us.
I wanted to respond to what Dr. Larry said about it's not enough to just not vaccinate. We need to do more for our children. For me, the key piece that switched my brain around vaccinations with my first child was the document that looked at plant life, that when plants are given all the nutrients they need, particularly the minerals they need to be robust, they would not get sick. And nutritionally deprived crops would have every bug coming across, taking them down. And I realized that was the issue that we need to look at with our population getting sick and our children getting sick. If we're nutritionally deprived or we have excessive exposure to toxins, we're vulnerable. And that's where the story changes about, yes, don't put more toxins in your body, but what can we do to optimize our health and minimize our exposure to toxins? Right? For me, that's the other piece in there.
Well said. Beautiful.
Mhm.
I mean, it's that simple.
Yes.
The body has one specific major task. Don't let waste, toxins, impurities, and inflammation accumulate. Because any accumulation of waste, toxins, impurities, and inflammation will compromise cell function, tissue function, organ function. And so everything we do is to make sure impurities get out. So that's why we exhale. That's why we urinate. That's why we poop. That's why we get stuff out our skin. That's why we sleep. And that's why we produce mucus. And so if the body is in this Libra-like scales, there's no reason to have symptoms. But if you're putting more wastes into the body than the body can handle, it just can't keep up with excreting and eliminating, then something in the body has to say, I'm not ready to die, so I'm going to have to do something to make sure we don't die. And that's what an acute illness is. And if we're going to change the paradigm of chronic illness, we have to change the paradigm of how we treat acute illness. Because by suppressing acute illness, we create chronic illness by leaving the wastes inside the body, by not recognizing that the acute illness is a saving mechanism for the body so it doesn't die, so it gets rid of the wastes. And the thing is, even though my mentors in pediatrics didn't teach me that, that's what they taught me. Because what did mothers and grandmothers used to do? Get into bed, close the lights, get under the covers, draw the bath, draw the kettle, play quiet games, sleep, rest, don't go out. And guess what? Drink chicken soup. And guess what? Most people got better. I'm not talking about the areas where there was poor hygiene, poor sanitation, poor living conditions, crowded living conditions. That's not what I'm talking about. I'm talking about the run-of-the-mill acute illness. And mothers today don't know what an acute illness looks like anymore because they run to the doctor. The kid has fever for more than 24 hours, and oh my God, it's an emergency. Whereas when we trained, kids had fevers 3, 5, 7 days. Yeah, that's all right. It's okay.
Well, and the same with the rash, like a measles rash, for example. That's the body's method of getting rid of the toxins, correct?
Well, it's interesting because when you look at all the acute illnesses in children, you look at measles, you look at chickenpox, you look at the flu, you look at a cold, you look at a stomach bug, they're all the same. Fever, mucus, vomiting, diarrhea, rash, cough. Those are all symptoms of discharge of excess waste, toxins, impurities.
But they do have different patterns though, Larry. They have like chickenpox, a particular type of skin rash pattern versus measles, so on.
But I agree with you. But if you look at the overarching set of symptoms, it's all the same. Discharge, remove wastes and toxins. They're all using the same body mechanisms that are body mechanisms that help the body remove excess wastes. And so we like to corner it and name it and make it a label and
it's special,
identify it so that we can make people scared. But in fact, if you close your eyes and just look at a kid with measles, look at a kid with chickenpox, they're doing the same thing. They're fevering, they're coughing, they're producing mucus, they're vomiting, they're diarrhea, and they're getting stuff out through their skin. And those are all, as people would say in homeopathy, they are exteriorizing their wastes. And so that's what you want. But we have to label it and then create a terror and a fear around it instead of just saying, oh, well,
that instead of celebrating it effectively, because that's the body, it's the body healing, is it not?
It is.
So I want to give
created something very dangerous, and that is loss of knowledge, loss of folklore, and ignorance and fear. Very, very, very tough.
One more thing, let me jump in on this particular topic, though, because I've been kind of thinking about, the 5 childhood illnesses and that occur in children, but not really in adults, unless for some reason it's suppressed to come out, by treatment, to come out at a later time. But I wonder if those illnesses have something to do with developmental changes in children, like levels that they step up onto. And if they do it smoothly without any effort, they don't break out in a rash. They never show chickenpox, but I suppose you might be able to find a chickenpox antibody somewhere, right, to show that they've done it, or developmental change that shows that they've done it. And I wonder whether there's something to do with developmental levels in the growing child that we're seeing as a disease, when in fact it's what you describe as underlying struggle that expressing on the surface. What do you think there?
I love what you just said, because if you study Chinese medicine, most of the traditional teachings will tell you that measles, mumps, chickenpox, rubella, flu, all of those dangerous illnesses are actually releases of fetal toxins. And we don't recognize that children in utero are exposed to a lot of junk, Plus, they're inheriting a lot of genetic material from both parents. And, when the brain is developed, when the baby's born, the brain has way more neurons than it needs. And the immune system is so immature. And so we talk about in pediatrics the pruning of the nervous system, or the pruning of the immune system. And when you see kids on the autistic spectrum, they were found to have larger heads comparatively to children who did not have autism. And so there's a rite of passage that you are describing that I completely agree with, that is specific to children, because there is a maturity, there is a pruning, there is a clearing. And, I've been working with practitioners in Chinese medicine for 30 years. And now that we're seeing so many kids who are not getting the childhood illnesses, or they're getting illnesses, but they're being suppressed so much, we're finding, at least from my Chinese medical practitioner colleagues, that these kids are very hot. They have a lot of heat inside of them. And these childhood illnesses, these rites of passage, are actually ways in which the inflammation, the heat, gets discharged. So, and if you really think about it, we get a little esoteric here for a second. When you look at a baby, how does that baby become an infant? How does that infant become a toddler? How does that toddler become a preschool kid? How does that preschool kid become a school-age kid? How does that school-age kid become a teenager? How does that teenager become a young adult? How does that young adult become a middle-aged person? How does that middle-aged person become an elderly person? So there's some degree of programming that's in our systems that allows us to evolve forward. And if there are obstacles to that program, if there are things that get in the way of what the destiny and the purpose of that person's life path is, then you got to get sick, because you're not yet ready to die until you're ready to die. And so what moves us forward is some divine or vitalistic or something that's in there that's programmed, that says, go forth. And all you have to do is water it, feed it, give it a little sunshine, and love it. But what happens if you get in the way? What if you curtail that program? Well, the body has to get sick in order to clear out what has gotten in the way. And so that's what you're seeing, Steve, is the pruning and then this developmental growth spurt. Because I see it all the time. And I remember the pediatricians in my medical school residency teaching us, oh yeah, all the time in their practices in the 40s, 50s, and 60s, they see kids get their flu-like illnesses, their fevers, and there was no suppression of the symptoms. And afterwards, the kids would walk, the kids would start talking, the kids would start behaving better, they'd sleep better, they'd have better appetites, because whatever obstacle was in the way of the program was cleared. And so what do you see in kids with chronic illness? They can't go forward.
Right.
Yeah. I think that's very much anthroposophical medicine too. Rudolf Steiner spoke about that. And there have been lots of, I think that what your observation is, these kids take a developmental jump after they go through an acute illness like that. So we have to redefine what we have been calling infectious diseases, and therefore all the things we've been designing to suppress those acute diseases,
Right.
such as measles, mumps, rubella. Yeah, it's a real shift in paradigm.
And just a flu-like illness or just a stomach bug. And I think if we do a historical retrospective look, we'll see that in the 1913 area, around that time, there was something written called the Flexner Report, which
1910.
Yeah, again, around that time, thank you, was an attempt to sort of unburden what might have been. So to really eliminate a knowledge base so that another agenda could be put forth. You know, and as a pediatrician, I can easily practice pediatric medicine without pharmaceuticals. And I do. And I have been for over 2 decades. That doesn't mean that I'm not looking carefully to make sure that I might not need one, or I might need one. But we can practice medicine without pharmaceuticals. But that's been hijacked. And, you know, I'll never forget 1983, first day of medical school, class of 87, which is what I was in, sitting there, the dean greets us, and within the first 5 minutes of talking to us, and I have no idea why I remembered this, but I did. The first 5 minutes of talking to us, he said, and I want you to know that nutrition is not a field of medicine. And that struck me, even as a medical student who, A, never really wanted to be a doctor, and that's another story in and of itself, but B, just thought, why would he say that? And I remembered it. It just plastered in my brain. And, you know, again, that's part of the Flexner programming, is remove any understanding of how the body works and replace it with how the body is deficient in pharmaceutical medicines.
Larry, we've only got a few more minutes with you, and I need you to at least say a few words. You said it isn't enough to not vaccinate. So what else do we need to do?
You're so grammatically good, Ted. It ain't enough to not vaccinate. A New York phrase. I own it. Well, we need to understand that the material that we put into children's bodies matters. You would never, ever fill up your gas tank with any old liquid just to make sure that the needle said full. And I think we need to have more respect for the body than we have for our cars. And so it matters what goes into the body, because there are many ways in which information enters the body: through the air, through the mouth, on the skin, injected past the skin, and specifically in the nervous system. And most importantly, whether or not we honor the true spirit of who the child is versus what the child wants. Because our job as adults is to make sure that we honor the spirit of a child by doing what's in the best interest of the child, not catering to what the child wants, because then we are creating disharmony.
Mm-hmm.
And that's inflammation. So our job is to recognize that the load of material we put into the body matters. And the load of material we allow the body to release matters. And if we're going to overload the body with more information than it can take, so more food than it can take, sensitizing foods that it can't tolerate, too much information through the senses, overparenting, smothering, toxic materials on the skin, toxic materials in the skin, we're going to create sick kids. Because the human body does the following. It receives information and understanding that information coming at the body, in the body, through the body is both pure and impure. And the body is built to discern what's pure and what's impure. And in that discernment, we're meant to eliminate the impurities out to the organs of excretion and elimination. But we know very well that impure material gets in anyway. And what the body knows to do is bring those impure materials to the surface through the organs of elimination and excretion. And then it takes the pure material and it utilizes it. And the byproduct of utilizing that information is impure material. And we must drive that material out to the surfaces of the body. And if we don't, we get chronic illness. Because the definition of a chronic illness is chronic inflammation. And chronic inflammation happens because too much inflammation is going in, not enough inflammation is going out, and the body is circulating a certain amount of inflammatory material, sort of like a traffic circle going round and around and around with no tributaries. And this is why we're creating chronic illness. We're suppressing the acute illnesses when the body needs to get rid of an upload, an augmented amount of wastes. And that's driving wastes into the body. And then we're not recognizing that we're making choices that put more wastes in and put more impurities in. So what's required is accountability, responsibility, education, and assistance, community, right? Parents can't do this alone. And we must educate them about the toxins in the air. We must educate them about the beauty of nature to combat the toxins in the air. And we must educate them about what food is. You know, it's not enough to give your kids, processed food. It's not. It's going to wear them down. It's not going to keep their brains thriving. And if you want to overcome this AI, if you want to overcome the cell phones and the apps and the social media and the addictions, we must, as a group, as a community, band together and make sure that we are not overburdening our children and not stopping the removal of these wastes when they need to come out.
I just wanted to comment, Larry, on this idea of waste. Most people think waste is like some toxic burden that they're eating, but it could be an emotional sort of waste as well. So in other words, a child that's in a very anxious situation where they don't have, they feel, maybe not supported by their family, or something's happening at school. So would you comment on that, about the psycho-emotional component?
Sure. Well, that's what I meant about being aware of the spirit of the child, because we must understand the capacity of each developmental stage of children, and we must honor those stages and not bring them up too quickly or reduce them while they're growing up. And when I talked about before about information coming into the nervous system, that includes the emotions. In fact, it's predominantly the emotions. because children learn by what they're modeled. It's modeled in their homes and around them. They rarely learn by what you tell them. And so if you're putting children in an environment that is emotionally unstable, they're going to learn that as a normal response to life. If you traumatize children, they're going to learn going forward that situations that don't go their way are going to be treated as if they're being traumatized. And so I think part of how we teach families how to raise healthy children is to start teaching normal development again. Start teaching, when I've watched parents of 3 and 4-year-olds just talk to their kids like they're getting a doctorate degree in philosophy. And I'll say, what are you doing? Well, I'm just explaining to my kid. I said, do you know your 3-year-old or 4-year-old isn't processing what you're saying? Well, what do you mean? I said, well, don't confuse verbal ability with conceptual capacity. And so that's an overload on the kid. A 3-year-old doesn't care about explanations. They must be talked to a different way. They must be played with a different way. And when a parent of a 4-year-old says, oh, my kid is so smart, they know all these things, I'll look at the parent and say, please don't take this the wrong way, but I don't care. Because I don't care about your child's IQ. I want to know about your child's EQ, your child's emotional quotient. How is your child playing? How is your child imagining? How is your child creating? How is your child making things up? How is your child learning to socialize? How is your child developing an ability to respond to discomfort? How is your child being praised? Is your child at 3 getting a yay for everything they do? Well, you're setting them up for performance problems when they get older. Because when they get older, people are not going to praise them that way. So they're going to feel a real loss in their lives. So again, I mean, I can speak for hours and hours and hours on end about just child development, because that's what creates that emotion and that emotional incongruity that we're talking about, where, I see kids who are raised without vaccinating, but because parents never say no or don't create proper boundaries, these kids are anxious as all get out because they never learned how to cope with not getting their way. Well, newsflash, 50% of life is uncomfortable. 50% of life is comfortable. And if you don't teach a child to get through discomfort without you, then they're going to fail at life. And that's what destroys the emotional intelligence.
Dr. Larry, I want to honor your time. You just said that you could talk for hours and hours, and I know that to be true. Where can people find more of what you have to offer?
My website is drpalevsky.com. That's drpalevsky.com. There are a lot of videos and interviews and materials that I've put out on my website. And I do a Thursday night Critically Thinking with Dr. T and Dr. P website at 7 p.m. Eastern time. And that's been going a good almost 5.5 years.
Wow.
And I do talks all over the place. And that's usually on my website or in my newsletters. So if you're interested, if you are in any way curious about what I do and where I'm coming from, come listen, ask questions.
Boy, you delivered the wisdom once again. This was a beautiful conversation, and I think it helped to shift us to be much more respectful of these bodies that God has given us. So thank you. Thank you.
Thank you. Thanks for holding the space for my passion around this subject. Because once you get me going, I'm like...
It makes you a very easy guest to interview.
Oh, thank you. Anytime. I love my friends up north.
Thank you. You are very much of a service. If you find value in these conversations, I invite you to support Vaccine Choice Canada with a donation. Your support allows us to do even more, to educate families and to protect our right to medical choice for ourselves and for our children. To make a donation, go to vaccinechoicecanada.com.